Jump in here, Ellen? Is there any, oh,
Yeah, just jump in. I was going to
is
give
there
an
anything
intro, but
else?
you can intro yourself.
I'm gonna just put this up and yeah, I think we got this running. All right. So here to talk to you today about sex and ADHD. I'm so thankful to be here and to be with you all. Love that we're recording, but we will be doing a bit of a break in the recording at the end, and we'll go over that in a minute. Um, Not sure. There we go. Okay. So I just wanted to thank both Andrea and Ellen and everybody else on the CHAD team for having me here. And I'm missing an H. So there we go. We're going to be talking about ADHD and inattention right there from the get-go. So who am I? What is going on here? My name is Lyne Piché. I'm a registered psychologist, and I've been working as a psychologist and a sexual therapist for 26 years. I'm up in Canada, Vancouver, beautiful coastal. So in my world, it's still dark already, but we're still earlier in the day than it is for all of you. And some of the work that I do has involved a sexual therapy and relationships. And so I've really gotten to know and work with this intersection of ADHD and sex. And I'm so excited to be talking about this with you. Wanting to always kind of do my disclosure and my conflicts of interest so you know where I'm coming from. Some of you may already know this. I do have the workbook out. I have another book out specific to internet images and internet use. I offer educational courses and a master class as well if you're a clinician. So all of this is out there, and I always want to be super upfront before I get going about the context and the things that I like to do for fun. So, as we're working today, you will notice that I have a lot of questions. I'm going to encourage you to have like pen, paper. Because of the recording, I'm going to give you a few minutes kind of when we hit some question points as we go through. But if you're most comfortable waiting till the end, I'm going to do my best to finish with a good 15, 20 minutes so that we can get into some of these discussions or maybe answering some of the questions with the recording off. If you don't care and it's okay with you and you're all right to be recorded, then don't hesitate to jump in. And if you want a completely anonymous option for your questions, sometimes when I give talks, I like to give people sticky notes and you can kind of write it down. This is our online version of sticky notes, which is courses at drlynnepiche.com. Send me an email. If I have time during our talk, I will check my inbox to see if I can answer your questions here while we're live. And if that doesn't work, then I can respond to you a different way. As we go through, you will notice that I will use first person language as much as I can, but you'll also hear me use ADHD or ADHDers, and it's certainly what I use in the workbook. To me, it's very warm and inclusive, and this is why I use it. I know other people might prefer a different kind of labeling or no labeling at all. And so I want to just put that out there that the reason I'm doing it is inclusivity, and I want to make sure that everybody's comfortable. Okay. My favorite part about talking in CHAD presentations is that I don't have to explain what ADHD is. We save so much time. But I did want to bring up this one chart that I like using, which is all the ways that ADHD can impact people and this idea of what happens when you're neurospicy. And you've noticed that I've highlighted some things, and those things can really impact your sex life. And it's why they're highlighted. And we're going to be talking more about some of these intersections, and some of them are things that hopefully you can kind of start thinking about that we probably won't have time to get into today, but at least you can kind of start thinking about how this might impact you or somebody that you love who has ADHD. I've got this really cool neurodivergent dysregulation chart from Kustoff, and Kusto is a psychiatrist who did a talk for Attitude Mag, probably maybe 6 months ago or something. And he had this really cool slide, and I want to thank him very much for the fact that I'm stealing it. Uh, but he looks at ADHD from this aspect of these domains of dysregulation. And I really thought that this was lovely because you can see the kind of broad strokes in where ADHD can impact you. And so, my first question for you today is how can these areas impact your sexual functioning? And just maybe take a moment to have a look at this, whether we're looking at attention or your activity levels or that impulsivity. Does time appraisal and difficulty with time blindness, can that impact your sexuality? And does that apply to you? What about circadian rhythm? As a sex therapist, I've spent years with people going, I'm a morning sex person, and the other partner goes, no, oh no, I'm night only. It has to be at night, and never the two shall meet. You can see how some of these things can start impacting what happens for you sexually in your relationships. Even things like that inflammation and the autoimmune. The last slide, I was talking about this link with IBS and some of the food sensitivities. And you can imagine that if you've had a meal and you're not feeling very good in that digestive tract, you're probably not going to be going, hey, this is great time for sexy time. So we're going to talk about some of this stuff, but I want you to start maybe just reflecting on how this may apply. When we're looking at research specific to ADHD and females assigned at birth, have a sense that many of you will know some of this already. We don't have a lot of research. We have, just this very kind of small start, but many women who are neurospicy are going to very much relate to these differences throughout the cycle and how that also impacts what's happening for you. And I'm going to encourage you to think about how does this change in your hormone levels and this increase, this spike of ADHD symptom impulsivity around day 14, and this spike of emotional dysregulation and emotional impulsivity around day 24 to 26. How does this impact your sexual functioning? Does it impact the functioning within your relationship? How have you learned to kind of navigate and work with this to turn it into an advantage? Okay. So when we start looking at ADHD, you can see how many of these things that impact your ADHD can start having links to your sexuality. Okay. And I promise to circle back about like, what are you going to do about these things? But let's start here. The third one I wanted to highlight is the stimming on others problem. So I really like this concept, this idea that if I am stimming on you, my brain is bored, right? So I'm sitting in the car and I'm going, oh, this is really boring. We've got another 20 minutes. Maybe I say, well, let's start a debate. Or maybe I go, hey, I don't like that shirt or whatever, right? I'm using somebody else to keep my brain occupied. And when we think about our sexuality, do we also stim on other people using sex? I'm bored, so I'm going to initiate, even though maybe the context isn't great, and I know the context isn't great. I'm bored or I'm sitting here, so maybe I'm going to throw out some sexual thought or sexual idea that I know is going to provoking. Is going to provoke you or be provoking. Maybe we start a debate. And so, this importance of addressing the stimming on, particularly as it's impacting your sex life, both if you're picking fights with people, probably not going to want to have sex with you at the end of the day. And if you're using sex to try to get things going or keep your brain occupied, oftentimes partners can feel like they're being used or what's happening is like not about them. It's not this romantic view of sexuality. So, do you and your partner identify as neurospicy? And has ADHD impacted, obviously, your life, but your sexuality and your relationships? And so, this is kind of where we're going with this conversation today. And we will circle back at the discussion. I have some questions for you where we can start looking at some of these impacts. I encourage you to think about how you're seeing that impact. And I'm going to spend now the next little bit just sharing information with you about what the research is telling us. And we'll be able to see, like, how does this align with your experiences? And I'd love to hear more about the ways it aligns well and maybe some of the ways that it doesn't align so well. Okay. So when I'm talking about sex, I am talking about play. Sex is about pleasure. It is a way that we play together. It is not about intercourse. So, sex has nothing to do with intercourse. It has nothing to do with having an orgasm. It is simply the play that I am having with somebody that is physical in nature and enjoyable and fun for the people that are involved. Whether that's solo, you can play with yourself, and that's totally fine. Whether that's partnered, I can play with a partner, and that's what I'm doing. And to be able to play, you really do need to be present and in the moment to experience that pleasure and to play with somebody. Okay? So every time I say the word sex, please replace that with the word play. And that might also help as we're going through if that's maybe it's a topic you're less comfortable with or you're kind of wondering how things might apply. So there are many different ways in which we hear as clinicians about ADHD and sex. You may hear or experience things like, I'm in hyperfocus, I'm working on this project, I don't have time for sex. I've got the to-do list, and sex is not on the to-do list, so it's not there. Or maybe I try to have sex, but I'm really distracted. There's a dog barking. There's, a thought that runs in my head. There's some noise. I don't know about privacy, so I can't stay focused. I'm not enjoying it. It's no fun. Not going to do it. And if I lose focus during sex, maybe that means I don't like the activity or the partner or sex. Maybe I give up on it because I'm like, well, this isn't a lot of fun, so forget it. Oftentimes, people won't be able to sit in their bodies long enough to figure out how they feel. And so that sensation of pleasure isn't there, and the transition towards sex doesn't happen. You may also feel that solo sex, which would be sex on your own, or you and a computer, is just easier than partnered sex. There's less distractions, maybe there's less sensory issues, and you're just able to enjoy yourself. And the one that many people don't say out loud, but often is a big part of this, is I'm bored during sex. There hasn't been enough going on that's different or pleasurable. And it's like, meh, it's kind of all the same thing. So, when we look at common ADHD and sex problems, we see attention problems, transition problems, and I'm going to talk about transitioning into sex and transitioning out of sex today. We have sensory or sensation problems, and we know that people with ADHD have sensation problems. They have sensory concerns. Historically, when I first, started working and training as a psychologist, we never talked about sensory concerns. We certainly didn't talk about it unless somebody was maybe on the spectrum, and then, you would say, okay, well, if this is autism, then maybe there's sensory stuff. But we know that that is also the case with ADHD. We have problems with hyperfocus and anxiety. Sexual dysfunctions are all, and I dislike the word, but it's all of those sexual problems that don't seem to go away. They kind of follow you partner by partner. We've got problems with intimacy and masking and that poor interoceptive awareness. And so we're going to talk about a few of these today. We won't have time to talk about everything, but we will do what we can. So, the basics is that sex requires attention. You need to be able to pay attention to the idea of having sex, that feeling of pleasure, your partner and their needs, plus your needs. And I've talked about staying in the present, as well as your actions and other people's actions. Distractibility is often a problem for people with ADHD, particularly during sex. And it's one of the questions that mental health providers we typically don't ask. And oftentimes people don't think to say, right? I'm having sex or I'm about to initiate sex, and my mind is elsewhere. I'm just not here in the room. So, can you or your partner stay in the moment during sex? And if yes, what works? And if no, what have you tried to make it work? And I'm going to invite you to just take a note of that and we will come back to it. When we look at the research, what we see is that people with ADHD report more diverse sexual experiences, more consensual non-monogamy, more gender fluidity, more bisexual experiences, even if you're not reporting being gay or being queer as part of your sexual orientation. So it really is this, well, maybe I'm straight, maybe I'm bi, but at the end of the day, there was this person, I had sex with them, the opportunity was there, why not? But it doesn't necessarily line up with your maybe stated sexual orientation and perceive themselves as being kinkier than people who don't have ADHD. And Tuckman talks a lot about this idea of the novelty and the need to not be in the same sexual routine, particularly when you have ADHD. And we're going to come back to this. Other things that we see, people with ADHD report higher number of sexual partners, higher rates of condomless sex, higher STI diagnoses. Deadpool talks about this in the last movie. For those of you who enjoy Deadpool, makes a comment about ADHD, sex, and STIs, right? So the information is getting out there. Higher number of unplanned pregnancies, more emergency contraception use, and more infidelities, more divorces, less relationship stability, and less relationship satisfaction. And there's a lot of reasons why these things are there, but you can start seeing how sexuality for you as somebody who has ADHD, or if your partner has ADHD, or you're working with people who have ADHD, becomes important. Okay, so when we're looking at youth and we're looking at youth studies, please note that a lot of the samples are not just teenagers. Sometimes they'll be teenagers, sometimes it can be young adults up to 26. But we see the same pattern. Earlier initiation of sex, more sexual partners, more casual sex, more pregnancies, which kind of goes with more condomless sex, more relationship turnovers. And we see this idea that maybe inattention is a part of this. And I am going to definitely come back to that. When we look at youth as well, we see much higher numbers of high risk sexual behaviors, more of this sexual hypersexuality. And this is this difficulty of transitioning out of sex. And we're going to come back to that theme a little later on today. And we see this both with many people with ADHD, but it's not necessarily gendered. So if we look at ADHD girls who are assigned at birth, we see this kind of similar pattern, and maybe it's even more for the younger girls, which is interesting because we typically have this idea of that being quite gendered, and so maybe that's not going to be as simple. And of course, if we have teens or juveniles that are kind of connecting risky sex and we're adding cannabis use, that can make that shift even worse. So maybe variety is required when we're looking at ADHD and sex. Maybe all of this research, and you can kind of see the main themes, seem to be connected to this idea of needing things to be different, wanting things to be different, this idea that Dr. Tuckman was talking about around being sexually eager and wanting things to be kind of new and novel. One of the things that we can see is that rather than having novelty, people will use intensity. So I will up the intensity. I will do something wilder and wilder or riskier and riskier to get that novelty in sexual play. And some of the concerns around intensity is that sometimes there is never kind of an end to the intensity. It just kind of keeps ramping up and you can get yourself into trouble. And maybe that's where we're seeing the condomless sex, and maybe that's where we're seeing the high risk behaviors. So trying to integrate novelty in your sexual play is one way that I encourage people to address this. And the other way is looking at variety. How do you create that variety so that sexually things can be new and different? You're not always doing the same thing, but it's not necessarily this upgrade of intensity every time. Now, you notice that I'm using this idea of touch. So, one of the things I really like to do with people is just take your hand and pat it nicely, nice and soft, and just notice what that does for your attention. Does it stay focused on the feeling? Does it go away? Do you start thinking about your to-do list? And then I want to give your hand a nice hot slap. And what does that do to your attention? Where does your focus go? And you may have found that that hard slap, that hard touch, is much less distracting, where your focus gets connected much more than the really soft touch. And these are some of the ways that when you have ADHD and you're having some problems around distractibility, maybe it hasn't occurred to you, or maybe you haven't known how to ask about this novelty piece, about this hard touch piece. Those of you who know about the neurodivergent love languages, you'll know that hard touch is one of the neurodivergent love languages, which is really cool because it really, I think, comes back to this idea of how do we grab our attention during sex? How do we kind of beat this distractibility? Some other ways that you can do this is focusing on a body part or a particular scent. I really like using music to create this feeling of um, kind of bringing your distractibility down and kind of getting you zoned into the moment and getting you into the room. And there's a lot of things that I talk about specifically in the workbook around how do you kind of get your environment to be less distracting. And there's a lot of ways to do that that are very much the typical ADHD friendly ways of doing things. We reduce some clutter, right? We do the things that we need to do, all of those like getting rid of those doom piles so that you've got a space that feels a little bit more comfortable. Now, when we're looking at sex and ADHD, the other thing that we need to keep in mind is that sex requires, okay, somebody's got a, has somebody got a marker? Does everybody see this? No? Okay, yeah. All right. Um, Sex requires a connection to your body so that if you're able to get into that connectivity, you're going to have a better time sexually. And we're going to talk about why this matters in a moment.
Is there any way we could erase it? It's distracting. Aviel, you said that you think you can clear them on the
I will
whiteboard.
leave it. Okay, I will leave that up to you guys. So this interoceptive awareness and that connection between mind and body is very important when we think about sexuality. And as a sexual therapist, we're often encouraging people to find ways to connect. So how does this relate to ADHD and sex? We see that premature ejaculation can be really common with people who have ADHD, where that ejaculation is happening within 30 seconds to a minute without your control. And you can see how that mind body connection might be really important to that. How do I know that my body is increasing in arousal? How do I know that I'm hungry? How do I know that I need to go to the bathroom? These things are all interoceptive awareness. And when we look at premature ejaculation specifically, there may be some physical reasons for that, like low levels of vitamin D and other things, but it may also be this connection. And it's interesting to me that we see this more with people who have ADHD. We also have this connection to sexual dysfunction, difficulties reaching orgasm, greater orgasm dissatisfaction, and more sexual distress. And in the land of sexual therapy, sexual distress is not a good thing. We do not want this. And when we see that consistently, we have research coming out saying, yeah, if you have ADHD, you're maybe more likely to experience this. We want to get a better sense of what that is about. So, what you can see in females assigned at birth, difficulties with desire, arousal, orgasm, satisfaction, sexual pain, lubrication. And specific to males assigned at birth, we have difficulties with orgasm, erectile functioning, and intercourse satisfaction. And so when we see some of these things, this is that connection, right? So if you have ADHD and you're having sexual problems, it's not all just in your head. This is the thing. Thank you so much for getting rid of the lines. I appreciate that. So oftentimes our suggestions are to, well, do your mindfulness, practice your grounding, The issue when you have ADHD, as you all well know, is that's really, really hard. And I know I often hear people in the ADHD community going, well, but the mindfulness works. Yeah, maybe. But like, I can't get there. Can you get there? And if you can't get there, now what? A lot of active grounding can be just as helpful. Going for that sprint, going for that run, doing planks, the same way that you would do other ways to get that body connection going, you can do that with sex as well. And it doesn't have to be the passive grounding if that's very difficult for you. There are other ways to get connected to your body. And for those clinicians out there, without this connection or with this weak connection, it's maybe not helpful to be saying to clients, well, just do the passive grounding, because if it's not going to happen, it's not going to work, then clients just get stuck in this loop. Right. And so if that's happened to you with a clinician, it's important to tell them, hey, I've got ADHD, and that's probably not going to work so well for me. The third thing I wanted to identify is this business around the sensory concerns, that ick factor. We don't have language around sensory icks in regards to sex. It's not something that we've often talked about. It's not something that's like very commonly discussed. And so part of what I keep seeing for people is they are having sensory concerns, but it hasn't even occurred to them to think about that as a sensory concern because we don't talk about it. And so the ick is real, right? And if you get the ick with mushrooms, or you get the ick with the wet spot, or you get the ick with whatever, like the tag at the back of your shirt, or maybe it's just not the right softness, that's going to impact you sexually as well. It's going to be distracting. It's going to create this feeling of being unsafe. And so when we're thinking about sensory concerns specific to sex, we're looking at certain tastes or smells, textures. A lot of people really have either problems with the sticky of the lube or the saliva when you're trying to kiss somebody, or that sticky of the semen. Temperature, things being too hot, too cold, noise, lighting, hair, skin, and all of those textural things, and touch. So asking yourself and a partner, are you experiencing sensory concerns? Is this happening in the bedroom? Particularly if you have a neurospicy partner and they have sensory concerns, how are those being translated when we're trying to have sex? What's happening for you? Asking the question is that first step. So we want to be talking about this, looking at those sensory reactions in other parts of your life and seeing if it's there, then maybe it will be over here. Using sensory blockers. So sensory issues it's not a psychological issue, right? It's not like you have a sensory issue and you're going to think your way out of it. It's kind of like sexual pain. If you have sexual pain, you have to stop. You are not just going to push your way through. That will make everything worse, right? We don't want to do that. With sensory issues, we're simply looking at blocking them. We're not trying to grit our teeth through them. We're not trying to just like make it all okay. It's going to be, well, if I have a sensory issue with the lights, maybe I'm going to change the lighting. Or if I have a sticky, maybe I'm just going to use and try 10 different lubes before I get the right one that's not upsetting and not sticky and doesn't create the ick. And that is totally fine, right? It's part of that ADHD tax. You might have to buy 10 lubes, but at the end of it, you'll get the right one. And allowing yourself to kind of look at these sensory concerns in that way. So when we're talking about sensory concerns, I really encourage you to label it for yourself. And there's another, no, it's not a typo. I always wonder with some of those. Name it to your partner or your partners. Normalize it. This is okay. You don't like mushrooms, you don't eat mushrooms. It's the same thing with the sexual stuff. And work around it or drop it. And sometimes you're going to use earplugs. Sometimes you're going to have those sunglasses, or you're going to change the textile. There's a lot of different ways to manage odor and skin textures. And, we're not going to go into it in a lot of detail, but the information is out there if you're looking for it, and there's definitely more information on my website. And there's also, I want to come back to kink in a minute, but there's a podcast that I did with Kate Osborne on this theme. So if this theme is like a big one for you, this is like almost an hour of dialogue around the sensory issues. So please kind of get out there and get more information about this. Um, Kink can be really helpful dealing with sensory issues and as well with the distractibility. So I'm going to keep going and we're going to come back to that theme of kink. And here's a alert, is that one of the easiest ways to improve your sexual functioning is to address the ADHD and improve your overall ADHD symptom management. We'll talk a bit more about that. So part of addressing that is transitioning into sex. You know how right now ADHD and productivity, and Dr. Tuckman's got his new book out on productivity. And so there's this real conversation now about ADHD and being productive. How do you get rid of that decision paralysis? How do you get rid of some of the ways that get you stuck? Transitions into sex is very similar. It's that same getting out of the stuck piece, but in regards to sex. Okay. So, one of the things that you will see, or maybe you've experienced, is those impulsive transitions won't necessarily land right, right? Maybe I grab a partner, I'm trying to do things too fast. Maybe I'm hyper focused on other projects. Maybe I'm trying too hard or not hard enough. And when you're struggling to transition into sex, what tends to happen in partnerships is people go, "You must not be interested in sex with me. You must not be interested in me as a partner," rather than looking at this like any other transition problems that as neurospicy folks, we kind of struggle with. So if we look at that impulsive start, right? So you jump in and you kind of startle your partner and you're like, "Hey, let's do this." Or, you grab somebody's butt or you grab somebody's boob. That other partner might be going, "Oh, this is not a good way to initiate with me. This is too impulsive. It's too strong. And there hasn't been enough kind of lead in." This can happen a lot for people who have ADHD. And so if your starts aren't doing it and your partners are not responding well, maybe you need to first think about how are those starts happening for you. There is a sexy communication guide that I've developed because I think sometimes trying to find words for this can be very hard. Both if you're neurospicy and you're having a hard time with communication, maybe it's hard for you to talk about sex, or maybe you have a relationship where that hasn't been something that you've done a lot of, and you're like, "I don't think I can really say these things that Lynn is talking about right now, but I can certainly say to my partner, 'Hey, I'm a 5 right now,' or 'I'm a 6,' or heck, 'I'm a 9,' right?" And you can see how the numbered labeling may also create a little less pressure for a partner as well. It's maybe not so impulsive. So other ways that you can do this is to find kind of that slow lead up and sexual stories in text messages, ways in which that sometimes I'll recommend that people put an object out, right? Maybe there's a stuffy or a fridge magnet that you can put out that lets your partner know that you're interested. So the other transition problem that can happen for people is this hyper focus on other things, right? So I have ADHD and I'm really busy and I forget how good sex feels. Or maybe I'm a parent in a neurodivergent family and it's taking up a lot of my energy and a lot of my time, and there just isn't really space for that. Or maybe that time blindness, remember at the very beginning, I was talking about Gustav, kind of ways in which things can be dysregulated. The time blindness can really interfere with your sex life because you're like, "Yep, I've got time for sex. Okay, we're good." And all of a sudden, the Instagram scroll starts and you're like, "Oh, you know, here's this cool thing I saw on the Instagram," or "there's this reel," or "Dr. Lynn put up this reel about impulsivity," or all these things, and now you're gone, right? And that time you would have had to connect with a partner has been sucked up by other parts of your life. The hyperfocus can really disrupt both time for sex, but also the relationship maintenance that you're maybe not doing, which then creates more distance in your relationship as well. One of the ways to deal with this, of course, is to help your partner with the chores so that the to-do list is a little shorter and everybody's kind of participating. Other ways that you may want to address this is when you are in hyper focus and you know you're like, okay, I'm really into this project, you're going to carve time out with your partner about when sex might still get some airplay, right? So maybe you're really hyper focused on doing this thing, but every Friday night has carved out, and that is going to be couple time, regardless of the other projects that are going on in your life. So there are ways of doing this. It's just can be a little tricky. It requires a little bit more planning. Sometimes with those transitions towards sex is they're too slow, right? So we talked about too fast. Sometimes they're too slow. Your partner doesn't notice that you're trying to transition towards sex, or maybe it's so slow that you've fallen asleep because you're like, oh, I don't know what's going on here, but this is really peaceful. And so now I'm sleeping. And maybe you're bored with how the transition is happening. Maybe there's not enough novelty in how you're moving towards sex. And so these are all ways that I encourage you to talk with a partner about and to consider when you're starting to get stuck on, like, where is this not working in regards to our transitions? So, hard touch can be fun. I've talked about this already. There is research out there about this under arousal and over arousal in the nervous system for people who have ADHD. And one of the things that I wanted to just alert you to is sometimes it's not that I need hard touch. Sometimes it's also the opposite, that I'm very, very sensitive, and there are certain parts of my body where I feel overstimulated very fast. And so having these same conversations with partners from that sensory perspective of, if it is overstimulating and if it feels really big, it's important for your partner to know about that and to discuss how that also impacts your sex life. So one of the examples I had for you is this frequency debate, which you may have experienced or you may have heard about. And it kind of goes like this. I don't like that my partner focuses on the frequency of our sexual activity. We don't have sex enough. It's all about when the last time we had sex, how come we're not having enough sex? We're not, right? That piece. Versus the other partner is usually saying, I don't like the fact that my partner ignores or refuses my sexual initiations. When I try to initiate, my partner just doesn't pick up the ball or says no thank you. When you're getting stuck in this frequency debate, I really would encourage you to come back to this idea of sex as play. If you're having fun and it's playful, generally you will transition out if you've got or into sex if you've got a bit of a plan. When you're getting stuck in sexual frequency, think about the sexual transition. How is it happening? Is it too fast? Is it too slow? What's going on? And really addressing the anxiety around sex, addressing the anger in the relationship, equalizing those chores, and those bad habits, which I call the sexual shortcuts. And sexual shortcuts can get in the way because you're using them to get your sexual transition going. But sometimes what happens is that your partner gets upset because you're always using a shortcut. And some of these other things are kind of other ways that you can get into trouble when it comes to engaging sexually. Maybe you're using sex to cope with some ADHD symptoms. Maybe you're having a lot of rejection sensitivity moments and it's eroded some of the trust and the confidence in the relationship. Maybe there's other addictions that are getting in the way. And you'll notice that addictions were on that first slide when we were talking about some of the ways that get into your sex or get in the way of your sex life. But definitely, if you're stuck in the frequency debate, you don't want to simply dismiss your partner's concerns, right? There's something there. So some of the questions for reflection, if this is something that it feels familiar to you, are up here, right? Are we both enjoying the sex that we're having? Are we both having fun? Are we both getting off and having pleasure? Am I thoughtful and considerate and during sex? Is my partner thoughtful and considerate? Are there sensory problems getting in the way? Have we identified and communicated what we both actually like? And but when I give this talk, I'm always like, oh, we need 5 hours, right? Because there's so many things in here that we could have discussions about specific to masking and ADHD, masking and sexuality. Am I willing to tell my partner what I like? And do I have an open mind to try other things? So, lots of ways to address this frequency debate. We're going to move to movement and then talk a little bit more about transitioning out of sex before we have some time for discussion today. But when we're looking at ADHD and physical health, you noticed at the beginning I was talking about some of those physical health disorders and pain and chronic pain. We also can have problems with movement and problems with maybe having more weight on our bodies than we want or need. And all of these things can get in the way of having that sex life that you want. So if your physical movement is compromised, you can set yourself up for success sexually. There are sexual wedges and pillows, there's sex furniture. There's a lot of ways to make you more comfortable, and you can go and use those ways to enhance your sex life. Maybe you need to talk to a physiotherapist or a movement specialist that can help you as well. But having that physical comfort during sex is actually really important. Whether that's a sensory issue and I need to change the sheets and have a blanket that really feels good, or I need to get a specific blanket to get rid of the wet spot because I really don't like that and that's getting in the way. Or maybe my knees hurt or my back hurts. And so there are different ways that you can approach that. And really, all I want to do is remind people that there's a lot of ways to make those sexual transitions easier. Sometimes you can make it a game. You can use that object to communicate. You can talk ahead of time about how you're going to facilitate this transition. The more sexual communication you have, the more you talk about sex, the better your sex life is going to be. And that applies across the board for people. When you're talking specifically about sex and ADHD, those conversations may need to be a little different. Maybe we're talking about sexual issues or problems. Maybe we're talking about sensory concerns, but it's the talking part that's going to really help. And getting rid of those myths around sexual transitions. If you're having a hard time with a transition, it may be your ADHD. It may not be as much about the situation as you're thinking. And it's not a way that we've often talked about this. So I'm going to encourage you to think about, how do you transition into sex? And we will come back to that. Okay. So if you've transitioned into sex, we need to transition out of sex. And the other thing we see in the literature about ADHD and sex is this correlation, this relationship between ADHD and hypersexuality, which means there are more people with ADHD that have too much sex, that are distressed by the amount of sexual thoughts that they're having, than people without ADHD. And when we look at the research fairly consistently, and you'll notice this with the youth as well, is what we're seeing is this link with the inattentive ADHD presentation, which is really, I think, super interesting. And maybe it's not the folks with ADHD who are hyperactive that have this problem as much as if you're inattentive. And of course, not everybody with ADHD will be hypersexual and will experience this. And that really is one of those myths. It's not true that everybody has it. But if you do have it, you want to be thinking about whether there's ADHD in the picture. This idea of sexual eagerness is a great concept that Dr. Tuckman talks about, this idea of this heightened sexual interest and engagement. And the important distinction between that and hypersexuality is that hypersexuality always comes with subjective distress. In other words, you're upset about it. The fact that you're upset about it means that you've got this upset and you've gone to ask for help, which also is going to slew some of those research numbers and the samples that I was talking to you about, because we've got a small group of people who are going, hey, this is a real problem for me. If we look at ADHD and sexual eagerness, people who really are enjoying sex without the subjective distress, we don't have as much research on that group. But I've got some ideas that probably we've got probably a bigger ADHD group in there, but there's just my idea. And of course, sexual impulsivity is the sexual decision making, but without considering consequences, which is different than I want to do this thing. I've thought about it. I know what the consequences are, but I'm doing it anyway, versus I'm doing it. If somebody asks me after, why did I have that affair? I don't know. I just did it and I didn't think about that consequence. So another way of looking at this is that eagerness is like it's fun. The risky is I'm taking a risk, but it'll probably go okay. And impulsive is I'm jumping in, but I'm not really thinking about it. So I want to come back to this because I'm mindful of the time, and this way in which we can deal with the too much sex and transitioning out of it with the positive and negative stim. So I'm going to come back to this. Okay. Um, I'm telling you that, that I'm coming back to it, but I'm sitting on it. Okay, so where I want you to really hang on to with this is that impulsivity is a neutral word. When we're looking at the shame and the guilt that comes with sexual impulsivity, I did something sexual too fast. I had this consequence, and maybe I've wrecked a relationship. Maybe somebody's upset with me. Maybe I'm upset with myself. The impulsivity part is not necessarily a bad word. It's not bad to be impulsive. It's about when you're making those choices, sometimes there's going to be a positive consequence and sometimes there's going to be a negative consequence. And how can you think about and use your decision making so that we're getting more positive consequences in regards to your sexual decision making than negative? Okay? And part of that is using that positive or that negative stim. Negative stim when it comes to sex would be things like anything that involves taking a risk where maybe your physical health is at risk or your relationships are at risk, or maybe you're having sex with somebody you don't know or online in ways in which that you're not sure what the outcome is going to be, versus those positive stims where maybe it's something that is more specific to, well, I'm having a good time, but I also know that I'm safe. I'm having a good time and it's not creating distress. That really is the key here. So sometimes people with ADHD will use sex to help with their focus and concentration. We have very little research on this, but you will see in social media this idea of post-nut clarity, right? This idea of once you have that orgasm, you can think more clearly, you can get that research paper done, you can write that report. And if this is a problem for you, sometimes it will get in the way of your relationship. And I encourage you to create more structured days to manage that ADHD, right? So I was talking earlier, like dealing with the ADHD is one of the quick ways to manage some of these sexual things that I'm talking about today. And maybe that means optimizing your medication. Maybe that means increasing your ADHD skills and creating those barriers so that you're able to find ways to manage the ADHD well enough that you're not having to use sexuality to do it. Okay, so we've got our core defining feature with this impulsivity, and I want to make sure that we have time for questions here. So what we're going to do is I'm going to move quickly and I'm going to stop sharing this for a minute. And I want to bring up the questions that I'm going to encourage you to have a look at and to consider. I really could talk about this for so much, for so long. Okay, let's bring up these discussion questions. Oh, I need to be here. So as you're thinking about some of these things that I've introduced you to today, or you've kind of have some thoughts about, some of the questions that I'm encouraging you to bring to the discussion is, what are you doing when you're playful? What barriers get in the way of talking with a partner about your sexual needs? What sensory issues are getting in the way? Have you tamed your sexual impulsivity? And if you did, how did you do that? What worked? What didn't work? Do you need to create balance between that to-do list, your life goals, and your sexuality? Do you choose positive or negative stim overall? And what does that positive and negative stim in regards to your sexuality look like? If you are struggling with the sexual frequency debate, how can you focus on sexual transitions rather than the debate? I do want to make sure that I have my so um, the workbook is a year old this week. I'm very excited. I like play, and so we're doing a whole happy birthday theme for anybody who's interested. That's kind of part of what's going on. But I want to put up my website and my email address so that if you have questions and you can send it to the courses or you can send it to my email either now or later. I really do want to hear from you and answer some of those questions, but I want to make sure that we've kept some time for the Q&A. And again, there's going to be like balloons and fun things all week. I'm like, I get cake. So I'm going to stop sharing and I'm going to just take those questions and throw them in the chat. And let's see what comes up for you as you hear this. And if there's any themes, because I do have, uh, there we go. Those are the questions. If there's any themes that you're like, hey, I really want to know about this ADHD and sex thing, and Lynn, you didn't talk about it, throw it out there. Let's talk about it now. I had way more slides prepared than I had time to talk through. So let's do it. Over to you guys.